Now back to Inside West Virginia Politics with Mark Curtis.
And welcome back to our final segment this Sunday on Inside West Virginia Politics. Again, we're devoting the entire show to the discussion of marijuana and cannabis products here in the state of West Virginia. I want to introduce Delegate Joe Ellington. He's a Republican of Mercer County. He also chairs the House Health Committee. Good to have you on the program.
Thank you.
I should mention, too, he's also a medical doctor, so you come to this with a lot of different perspectives. First of all, what's your view on medicinal marijuana? Should it become legal and available in this state, and why?
Well, it is a Schedule I drug, which technically says that there is no medical purposes. However, we've been seeing some data that suggest there may be. So I'm up for that. If there are medicinal purposes for it, I'm all for exploring it. And if we need to legalize it for that purpose, I am in favor of that.
Do you see anything in your practice as a doctor where it might be helpful? I know you're an OB/GYN by trade, but do you see things and talk to other physicians out there who say, hey, it might treat this or treat that or be beneficial to patients?
Right, different
for XYZ?
reports. I've seen different things that come up that it may help. My practice specifically, people with chronic pain, cancer patients, end-of-life type situations where they have chronic pain or palliative care may help them. One of the negatives I see is I have a lot of pregnant women that are using it because they think it's fairly safe, and that's adversely affecting them as far as they're carrying their newborns.
What are the potential consequences of that? I know we have a problem with women on opioids in the state getting pregnant.
That's a good question. We have a significant amount of people that are using it while they're pregnant because they think it is safe. One study my hospital down in Princeton did found that about 30% of the women tested positive for marijuana. We don't know the total effects on the developing embryo, and certainly as that child develops later on, what effects long-term it would have. Typical effects of marijuana smoking is going to be the same as similar to tobacco usage. You're going to have respiratory effects, risk of COPD later on, potential risk for cancer too.
But there are other ways to take medicinal cannabis other than smoking. In fact, it's not going to be available as a smokable product.
Right, not necessarily for that. It would be like a liquid form or gel form or something, patch, that type of thing. Right. So that typically would be would probably cut down on those respiratory effects that smoking would do.
As we've been discussing on the show, we're breaking this up into two aspects: the medicinal thing, and then the proposed bills that would legalize it for adult cannabis or recreational use. What is your position on full legalization for adult use?
Well, mixed feelings. I mean, we have issues with alcohol and tobacco being legal. You have similar concerns with marijuana. My big concerns would be for recreational. I am not in favor of it. We have a significant drug problem in the state. Adding one more component to that might be detrimental to our society. Same risk as far as smoking. It's going to be long-term usage. We don't know the effects on impairing individuals as far as being out in the community driving, working, things like that. It's hard to say what the long-term benefits would be for that. Colorado is already seeing some adverse effects. People that are proponents for legalizing it for recreational use are kind of touting that there's no negatives or downside to it. There is a downside to it, unfortunately.
Specifically what? What are you hearing from Colorado or other states?
Well, if you look at different behavior that individuals engage in, as I mentioned with tobacco and alcohol usage, same thing with marijuana. It may lead to them going into further type of substance abuse, things like that might be, some people think of it as a gateway drug. I believe that it has that potential.
Do you hear things from the medical community? I mean, I've seen studies on both sides of this issue, and there are a lot of them out there that say that, emergency room visits are up in certain places, or DUI arrests for the influence of marijuana versus alcohol, and it's actually adding to those problems.
Well, those are there, and that's a significant thing. We've tried to look at that in the past, but it's hard to regulate that. But yes, they are. West Virginia hasn't been too bad as far as the alcohol part. But with other substance abuse, we are seeing that. I think if you legalize marijuana and we have people that are getting out on the road being impaired, we might see that trend change.
All right. Well, we want to thank Delegate Joe Ellington, chair of the House Health Committee, also a physician here in Mercer County in West Virginia. You come to this with a good perspective, not only as a lawmaker, but a doctor, and we appreciate you sharing it.
Appreciate it. No problem.
And thank you for watching this week on Inside West Virginia Politics. We'll be back here at the Capitol with another program next Sunday. Have a great week.